Hey guys, Ryan Wyatt with you from Talon Tactical. I'm the Director of Training for Talon Tactical Medicine, and I'm here with my business partners and good friends from Spartan Armor Systems. So a little background, I'm a 26-year medic, started in the military, I was Navy, I was a corpsman, been a ground paramedic, been a flight paramedic for over 10.5 years, and over 4.5 of those were in a combat arena. So there are a few differences with the advanced first aid kit. First of all, what you can see, we have different color patterns. We have an external buckle here that you could use, once again, to hang the kit, to move the kit. It has a Ripaway, so this would stay mollied to your kit, to your drop-down leg holster, for example, the back of your headrest, and you could just rip the kit off. You could throw it to your buddy or whatever else you would need to do here. Opening up the kit, it's got this red tab that once again stays between your two zippers. And what that does is, especially if you have gloves on or your hands are cold or your heart rate's up, you can pull this and it starts to open up your zipper pattern for you. Examine the kit a little further. There's subtle differences in here. The trauma scissors, for example, are small. And these are actually TSA compliant. So you could bring this kit on the airplane with you. It's a definite advantage of having the smaller scissors. They still work really well. It does have a little Sharpie in here. This comes in handy quite a bit when you're trying to write things down and you're just forgetting. The gloves, once again, the gloves aren't black. These are blue. Enable you to see blood in what you have on your gloves to make sure you don't contaminate yourself, so you don't cross-contaminate with another patient, because this is our advanced kit. This kit can treat multiple people. Another difference is it has a nasopharyngeal airway. This is the standard number 28 size. It has a SurgiLube packet on the back. This is for basic airway management. One step before in your triage colors to see, hey, is my patient breathing? My patient isn't breathing. I can just put a nasal NPA airway in them. So the next item we're going to talk about, and this is one of my favorite items in this advanced first aid kit, is the CAT tourniquet. The CAT tourniquet stands for Combat Application Tourniquet. This is by far the most recognized tourniquet in the United States, and I would go to say in the world. We carried this in Iraq, we still do. I have probably 6 of these in my personal vehicle. Tourniquets save lives. The CAT tourniquet is just a universally easy tourniquet to apply. It doesn't take much thought. It's very intuitive if you've never even opened this thing up. Another difference that is in the AFAK kit is it has the HYFIN vent seal. I actually carry this in my personal vehicles as well. As compact as it is, it's actually 2 vent seals in one. Why this is important is for if you have a gunshot wound, for example. If you have an entrance wound, you should always be looking somewhere else on the body for an exit wound. I can cover this for the entrance, I can cover this for the exit wound. Once again, it's a universal seal, so I can use this to seal wounds up. I can pull wounds together, once again, keeping the wound area clean. Another advantage of the advanced medical kit is it has our TCCC card. This, along with our pen, this is a wonderful item. I can mark down really fast, you know, what I've done, what the injuries were, if I took their pulse, if I use anything from my vehicle to find out their blood pressure, or just talk to them and get their name, something they're allergic to. Then when EMS arrives, you're just handing this literally to the EMS agent, and you have everything already written down. It saves time, especially if there's a change in your patient's mental status. A couple other things that this thing has is a survival blanket, a space blanket. Look how tiny that is. But I can tell you guys, hypothermia is one of the leading killers in trauma. Arizona gets very cold at night, maybe warm during the day. But what if you're in Wisconsin? What if you're in Canada? Once again, I can take this with me. This whole kit is portable and TSA compliant, but blankets make a big difference, all right? It's also really shiny and reflective, so I can actually use this as a signaling tool if I really needed to. If I didn't have an iPhone or my phone battery died and I didn't have a lighter or something like that. So once again, this kit is great because all these little things can be used for more than just one item. It has more gauze. It has 2 packs of the rolled gauze for your patients. Multiple use again for what we already talked about. And then the last item is your emergency dressing. This is much like the Olays dressing that you saw before. just more compact.